Well, thank you very much, LaVarn, for kicking us off today. And good morning, everyone. And thank you for joining the first session of our annual Dialysis at Home virtual community event. My name is Mike Spigler, and I'm the Vice President of Patient Support and Education for the American Kidney Fund. It's my pleasure to moderate this session, Managing Common Health Conditions Associated with CKD while Navigating Home Dialysis. People living with chronic kidney disease often must manage health conditions associated with their kidney disease. Our panelists today will share ways to control health conditions while navigating home dialysis. Our speakers will share the important benefits of working with your healthcare team to manage or alleviate the effects of these conditions through healthy eating, treatment options, and medicine. So let me jump right in by starting our discussion by introducing our esteemed panel of guests. First is Kathy Wong. Kathy has been a registered dietitian since 2014. For the past 7 years, she's been a renal dietitian with DaVita Kidney Care, providing nutrition support to in-center dialysis patients. She currently serves as a member of the American Kidney Fund Dietitian Advisory Group. She's also an active participant in the Academy of Nutrition and Dietetics Renal Practice Group. Thanks for being here, Kathy.
Thank you.
Next is Dr. Kasem Butt. Dr. Butt has more than 14 years of experience as a nephrologist, both clinical and interventional. He is highly versed in value-based care and trends in the kidney care market. He is also passionate about education through public speaking, social media, and video creation. His goal is to be a leader in the rapidly changing face of healthcare. Dr. Butt consults for innovative companies, including those focused on medical devices, artificial intelligence, telehealth, remote patient monitoring, digital health, health insurance, and much more. Dr. Butt, thank you for being here. And Asia Lee. Asia is a passionate advocate for public health education and empowerment. As the Director of Patient Education at the Arthritis Foundation, she leads the organization's efforts to equip patients with the knowledge and resources they need to manage their condition effectively. With expertise in DEI initiatives with a rheumatology focus, Asia develops educational materials, workshops, and programs tailored to the diverse needs of the arthritis community. Welcome, Asia, and welcome all of you.
Thanks.
Well, let's jump right in. And Dr. Butt, I'm going to come to you first. Could you give our audience an overview about some of the conditions that I kind of alluded to at the beginning that patients on the home dialysis journey may experience?
Well, I mean, home dialysis, by the way, thank y'all for having me here. Home dialysis is one of the biggest initiatives now with value-based care trends that we're seeing. And quite honestly, I've become very much a PD-first advocate with my patients and our CKD population that I work with. But there are, there may be some issues that they may face. Some of the basic ones are like the electrolyte issues. Many of them face potassium, phosphorus, then albumin, which is a protein in the blood, but also anemia issues and things like that as well too. But also, I know that this is outside the spectrum of what we're going to be talking about, but there's also a home burden of doing dialysis at home. That the burden of doing stuff at home that many people need to talk about as well.
Great. Well, you mentioned anemia. That was one of the things that you talked about. Can you talk a little bit about what causes anemia in kidney patients, and what are some of the symptoms and effects of that, and how can someone manage anemia?
Well, anemia, let's just go over some of the basic definitions, right? But anemia is typically measured by a lab value called hemoglobin. Okay, so normal hemoglobin in a male is above 13, a female is usually above 11 to 12. But anemia's definition is when that hemoglobin drops below that level, right? In CKD and end-stage kidney disease, what happens is your hemoglobin levels drop for two reasons. One is less iron in your blood, and two is less hormone that actually helps you make blood. The iron levels go down over time because at late-stage kidney disease, CKD 4 and 5, which is less than 30%, your ability to absorb iron through your diet goes down. So I can take a large load of iron from like a pill or from a meal and absorb it. CKD patients cannot. So oftentimes they have to get IV iron. The other component is that we have to, they don't secrete the hormone to make blood. The kidneys that sit there, they do a vast amount of things. And one of the things they do is secrete that hormone called erythropoietin. And as the kidney function goes down, their ability to secrete that hormone goes down. So these patients oftentimes have to have shots every 2 weeks or so of ESAs, erythropoietin stimulating agents. That could be in the form of Mircera, Aranesp, Epogen, things like that. So those are the two main reasons for anemia.
Okay, great. Well, I know gout is also a common problem that a lot of kidney patients have, whether they're on chronic kidney disease or on dialysis. And like AKF, the Arthritis Foundation has lots of programs aimed at educating people about gout. So, Asia, we're really glad to have you here. Can you tell our audience a little bit about that connection between kidney disease and gout?
Absolutely. So if we could put up that slide really quickly, just so we can get some imagery going. Yes. So I think first we have to talk about what exactly gout even is. So gout is a very, very painful condition caused by the buildup of uric acid within your joints. So the buildup can then lead to inflammation and swelling anywhere within your joints. But as you see in the picture, it tends to focus or kind of bring itself full circle at the toe. It can be in your fingers, in your knees, your elbows, and it causes swelling that many patients say feels worse than maybe getting hit by a car. So very, very painful.
Great. And for people that are struggling with this, what are your recommendations? I mean, you said how life altering this is. I know I've talked to patients as well where, the pain is unbearable when they're having a flare. What are your recommendations? And are there some simple and effective methods for managing gout?
Yeah, absolutely. So I think we have to back up a little bit and think about the impact of kidneys and gout. So your kidneys are like filters for your blood. So when they're working well, they're able to remove that uric acid waste that causes the buildup in your joints. But if they're overworked and they're damaged, like a lot of people with CKD, they can't remove that waste and it builds up. And now it causes those painful crystals that are all the way in your joints. And it leads to gout. So healthy kidneys are important for the prevention of gout, but there's management strategies that are available to you. One, you really have to maintain a healthy weight. So I'm happy there's a dietitian here. That excess weight can lead to the increase of gout. If you try to limit alcohol and sugary drinks, that can elevate those uric acid levels within your body that causes the inflammation and that extreme pain that you mentioned, Mike. So choose a healthy diet, one that's rich in fruits, vegetables, whole grains, and water to keep those joints lubricated while you are having one of those gout flare-ups, which is kind of that space when you are having the pain. And exercise regularly. I know it seems like something you shouldn't do when you're having pain. We just ask that you do it in moderation so you don't further strain yourself, but you do need to kind of keep those joints moving around. Motion is lotion.
Great. And I know that the Arthritis Foundation has lots of different programs and materials on that. Where would people go to find more information, on the Arthritis Foundation website for that?
Absolutely. Much like you guys, we have resources that focus directly on gout. So as you can see on your screen, we have what is called the Gout Hub. So if you go to arthritis.org/gout/patient education, you'll be able to find podcasts, webinars. We have a helpline. As you can see, at any given time, you can give that helpline a call and you'll talk to a warm body. They speak Spanish, they speak English. We have different translators there as well. And you can ask them anything from insurance information. Say you need to find a nephrologist as well as a rheumatologist to handle your joint issues. We can connect you with one. Our webinars, we do them monthly, and we also have them kind of stockpiled on our website and on YouTube, so you can always access that information. Those podcasts are there. Say you're just driving or you're riding your bike or you're on the train. Take some time to listen to some of those resources. And most importantly, we have what are called connect groups. Gout and kidney disease is sometimes lonely. It's sometimes tough to feel like you're by yourself in this whole scenario, and you're not. So our connect groups are pretty much like little sessions virtually where you can connect with other people with diseases just like yourself, talk about different management strategies, talk about medications, and just feel in community with people that are in similar scenarios as you.
Thank you so much. Well, Dr. Butt, let me pop back over to you. Asia talked a little bit about the lifestyle modifications for gout. What about medications? Are there medicines that people can take to either kind of keep their gout at bay or to manage it? I know in very severe cases, people get these crystal clusters called tophi, and are there things that help with that? I'd love for you to talk a little about some of the
yeah, I mean, there's certain medications on the market. Allopurinol is one that's for long-term maintenance of uric acid levels. And of course, that one in particular has to be dosed down accordingly as your kidney function comes down. Colchicine is another one that can be used in acute gouty flare. That's kind of common as well. Then, of course, like a prednisone dose pack, a course of steroids will actually help manage it as well.
Great. Well, we also have lots of materials on our the American Kidney Fund website as well. I'll maybe ask my team to drop some in the chat there. Our Goutful resources are really great as well.
I would add, though, always ask your nephrologist. All medications that you get from a doctor should be dosed accordingly to your GFR readings on your labs. So always remember to ask them that. And if you're on dialysis, the dosing is even different. So always ask about that.
Great. And Asia, one last question also just on gout as well is, who can treat this? Is it something that they should talk to their kidney doctor about? Is it a rheumatologist, their primary care doctor?
Yeah, so gout is something that involves a care team. So typically when you first have your initial flare, you're likely going to urgent care because of the pain, you're not sure what's going on, or you're going to your primary care physician. But once you guys kind of understand that this is gout, we recommend that you go ahead and get a rheumatologist because gout is arthritis. Sometimes it's not seen as that, but that is something that your rheumatologist will work with. But because there is that kidney function issue, we suggest that you also add a nephrologist to your care routine.
Perfect. Thank you so much, Asia. Well, thank you both already for the great discussion. If you're just joining us, thank you for being a part of our Dialysis at Home virtual event. You're tuned into our session called Managing Common Health Conditions Associated with CKD while Navigating Home Dialysis. We will have a Q&A at the end of the session. You don't have to wait to do it now. You can already send in your questions and my team will get them over to us. So you can just drop your questions and comments in the chat box. Well, Kathy, let me come over to you because it is important for dialysis patients to follow their healthcare team's guidelines for lots of different things that may be in their diet, but one of them that is maybe one of the most dangerous to deal with is potassium. What role does nutrition play in preventing or managing too much potassium in the blood, which is called hyperkalemia?
A vital role, so important. And the main reason is because potassium builds up in our body and there has to be a way of it coming in. The only way really is through foods. That's why it's really important for patients to be very honest with your care team, either at the dialysis center or even if you haven't started dialysis yet, even just your nephrology team, PCP. Hopefully you can connect with a renal dietitian even before stepping into a dialysis center, because it's very common for people to hear there are very strict foods you can and cannot eat, but it's really, in real life, it doesn't work that way. Not everyone has to struggle with high potassium, mainly because depending on the function of your kidneys are still able to filter some, maybe not completely, and that's why there's the buildup, but that's why having regular lab checks and talking with the dietitian or your doctor will help you navigate how much you can have, and also exploring the foods that and really understanding what foods are significantly high in potassium. And oftentimes it's the fruits and vegetables, which doesn't mean you can't have to avoid them completely. Depending on your level, how to incorporate them into your diet. And then when the levels are extremely high, what to do in those situations, because oftentimes if it's consistently high, the doctor might prescribe medication.
Great. Well, and I know one of the things I think everyone thinks of when they have a cramp and they're doing potassium is bananas. We have a Beyond Bananas campaign just for that reason, right? Because we want people to think about potassium more than just bananas. Is that something you see very often? And as far as like people just associating a couple of things, and could you talk a little bit about just, some of the other common things that have potassium in that people need to be mindful of?
Yeah. You make a great point, because on dialysis, it's not uncommon to hear of people having cramps. And that's why when they do, before they even do, especially for a new patient, I try to encourage them to let their care team know here at the dialysis center whenever they have symptoms, especially cramps. So bananas is a very common thing I hear people have. Pickle juice. Actually, those are the two common ones. And so alternatives, really, I would shy away from the quick fixes of putting something in my mouth. It will really be to tell the doctor or your nurse treating you like that day immediately, or the following day if you're having the symptoms at home. That way they know how to adjust the settings on the dialysis machine.
Great. Yeah, we came up with that Beyond Bananas campaign, and I asked my team to put it in the chat because we were talking to a dietitian that said they had a patient come in, and then they said, well, they told me I had to stop eating bananas, and they came back in the next day, and the next session, their potassium was super high, and they said, well, I stopped eating bananas, and I switched to plantains, so which is also equally as high. So we developed that campaign not to make light of the situation, but really to raise awareness about all of the different pieces that go into managing potassium, both diet, but also medicines as well. And Dr. Butt, I'm going to come to you. If you could talk a little bit about, obviously diet is one aspect of it, but some people, no matter how hard they try to manage this, their kidney function needs a little extra help managing potassium. Are there medications that people can take also to help with high potassium?
Yeah, no, absolutely. There are medications, but I would like to point, like we're talking about home dialysis, and one of the benefits of home dialysis, and Kathy probably sees this right off the bat, your electrolytes actually get balanced a lot easier because you're getting more frequent dialysis, right? So if there's people listening right now considering home dialysis versus in-center HD, because of the frequency of dialysis, PD is done every day, and home HD is done like probably 4 times a week to 5 times a week, your body's getting clean more regularly. So the restrictions on your potassium diet often can let up. And that's one of the benefits of home dialysis for sure. And so that's what I think we should definitely concentrate on. But also, there are medications on the market. There are certain medications on the market that can. The old school medication was Kxalate. I don't know if you heard of that one, but it's a little older medication. It actually makes your bowels move, and you secrete or you release potassium through your bowel movements. But there are other newer agents on the market, in particular Lokelma and Veltassa. Both of those work on the GI tract to actually help you excrete potassium in that way. So there are some medications on the market, but it really depends on the person. If they're on dialysis typically does the work of it, but occasionally sometimes they need that extra little help with the medication. But what I've seen is late stage CKD 4s and 5s, they oftentimes need those types of medications because, as Kathy's articulating, it's very difficult to manage a potassium because you have to avoid some actually pretty healthy foods sometimes, so it's but
yeah. And you mentioned the things that you're eating, but if you could talk about the other benefits of home dialysis, also like fluid restrictions as well. I mean, I know that's something. Could you talk about that a little bit too?
Yeah, so again, the way I like to think about it, so everyone talks about in-center HD because it's 85% of the market, 85% of the market, but I always like to think about it as it's 3 times a week, Monday, Wednesday, Friday, for 4-hour sessions, right? And on that 4-hour sessions, essentially they're trying to do 2 days of work of cleaning, right? So they're trying to suck off all that fluid off you, all those electrolytes off you and all that. And the times between dialysis, you have to restrict your potassium, your phosphorus, your fluid, because on dialysis, you're only getting it 3 times a week. But because you're getting it so much more frequently, you have less cramps, less restrictions on diet, less fluid retention, because instead of taking 2 to 3 liters off of you on Monday, Wednesday, Friday on dialysis, that you're getting a liter off a day or a liter and a half off a day with residual kidney function and your dialysis session. So it's a lot more gradual on your body and less cramping overall. You just feel better. You don't have that weakness and tiredness that you may have on an in-center dialysis session. So
yeah, and I think we can come back and talk about some of that too, and just how that helps from a lifestyle perspective too. For people, for the benefits of home as well. We'll come back to that maybe just a little bit. Kathy, one other thing, if I can come back to you, just that I know is also something that people need to manage. And I know when we're out and talking to patients at events, the line gets blurred and people get confused between the 2 P's, right? Potassium and phosphorus. Can you talk a little bit about phosphorus management and why that is important and how that's related to your kidneys?
Yeah, so phosphorus is something common that we hear in the CKD realm, especially during dialysis too, mainly because our kidneys used to help us filter, just similar to potassium. Our healthy kidneys help filter those things, phosphorus and potassium. But when our kidneys aren't able to filter at its optimal, a lot of those things get built up in our body. Phosphorus in particular, it is involved with our bone health. you may hear mineral bone disease or bone mineral disease, depending on the usage of it, but it's the same thing. So our body monitors the amount of phosphorus, calcium, and amongst other things to help keep our bones healthy. When our phosphorus builds up in our body, it leads to a cascade of events that will affect the strength of our bones. Not only that, it will also affect specifically how calcium is released from our bones. And so when that calcium is released, it deposits in all parts of our body because it can't go back into the bone by that time. And then we'll have complications, like the common ones are calciphylaxis, where you'll get calcium buildup in the vessels, you'll have open sores over time. So, and also like it affects our vascular health. And so there's a ton of other complications that will lead into. So ultimately, in the very get-go, making sure that when you're doing the labs, if ever the doctor says, hey, your phosphorus is high, and if they really want you to manage it. To be honest, with phosphorus, the damage is done over time. So if you see it right then and there, you're not in danger in that immediate moment, but it's really important to continue to manage it, making sure it's at the normal level consistently. You have time to kind of get there, especially if your levels are very high. But the key is to trend down to the normal level. And how do you do that? Similar with potassium, it builds up in our body because it's coming in. So making sure that the amount of phosphorus we eat is not as much. So focusing on foods that are lower in phosphorus, that's generally in the less processed foods. So let me kind of rephrase that. When we think about phosphorus, especially when your phosphorus is high, what I let patients know is generally to keep in mind, okay, what foods are high in phosphorus, and then focus on those and limit the consumption of them. It's humanly impossible to avoid, to have in your mind to completely avoid things that have phosphorus or things that have potassium, because there are so many things, and it's going to feel impossible to even put things in your mouth if you're constantly like being on alert. So that's why I tell patients to keep in mind things that are high in phosphorus or high in potassium, so that you can be mindful of just those, and then the ones that aren't on those lists you can freely eat.
Great, thank you so much. Well, Dr. Budd, I assume, with this as well for home dialysis, that this will help as well, just like we talked about with potassium, and make management a little easier. Is that true? And could you talk about the role home dialysis plays and maybe be helping with hyperphosphatemia?
Yeah.
And I'd also love thoughts on anything you have around any of the medicines binders for this as well.
Yeah, absolutely. So one thing I think what to add to what Kathy was saying, I think the difference between potassium and phosphorus and the way the patient should understand it is very high potassium can kill you immediately, right? A high phosphorus will kill you in the long term. You see what I'm saying? And so that's the high potassium can actually stop the electrical activity of your heart. A high phosphorus will literally calcify all your vessels in your hands and arms and legs. Quite honestly, as an interventionalist, I've done x-rays on people and been able to see their vessels without any dyes, because they're so calcified that I can really see the lining of their vessels, because those are the people that have high phosphoruses over time, and that phosphorus binds the calcium and deposits all over those vessels. But your question regarding high phosphorus and home dialysis. So one of the biggest things I'm about is decreasing pill burden on patients. Like, mm-hmm. I think we're in this weird state in healthcare as a whole, but we don't understand that taking more than 5 to 6, 7 medications a day is a burden on a human being, right? And imagine having to eat, every time you eat, pop in 5 pills in your mouth, right? That's horrible. To me, that's horrible. And almost the pill burden itself is almost like a meal in itself, right? So a lot of times with our patients that are in center dialysis, they have to take 3, 4, 5 binders. I'm sure Kathy has seen that. What's great because of the frequency of home dialysis, your blood is getting clean more often, your phosphorus levels kind of come down. So the pill burden of taking more binders with your food are less. And a binder, essentially what that means is a phosphorus binder, Essentially what you do is you put food in your mouth, put the pills in your mouth, that phosphorus binder binds to your food, right? And when it binds to your food, it doesn't allow the phosphorus to go into your blood. Sometimes that could be one pill. Sometimes it can be none. Sometimes it can be one. Sometimes it can be 5, 6. I'm sure Kathy's seen like a large version of them too. It can be a lot. But if you're getting more dialysis more frequently, that need for those binders are going to be less. And there's several of them are in the market as well too. You'll hear something called Foslo, which is calcium acetate, Renvela, Sevlamir, other ones as well as newer ones on the market as well. But that's, again, one of the biggest reasons I'm an advocate for home dialysis is hopefully lesser pill burden in that end, because lesser need for binders.
Well, we're going to save it. Thank you very much. And we're saving some time for questions at the end. And please feel free to continue to put your questions in the chat. Although we just got one that kind of links to what you just said. We have a question in the chat. Just how long do binders last? How long do the effects of them last?
Yeah, so it's a thing immediacy, right? So typically you get your pill bottle and let's say take 3 times a day with meals. I have to always explain to patients, if you don't eat, you don't take them. You see what I'm saying? They only bind to the food that you eat. So my patients that only eat twice a day, I'm like, no, take the 3 pills, the 3 binders with your meal. You don't have to take it without it. So a binder will not work if you don't take food, because there's no food to attach to. But as far as the longevity of it, it's more in the immediacy, meaning right then and there when you take it, with the food. So it's not a long lasting one. Although there is a newer one on the market, I forgot the name of it, but that has a little bit longer effects. But I forgot the name of it, so I can't bring it up.
Yeah, and that was a blocker. I think it's a little bit of a different way than it.
Yes, 100%. And I totally forgot the name of it, and I'm having a brain fart right now, so I apologize.
Exposa.
Well. Sorry, Kathy?
Exposa.
Yes.
Yeah.
And we have information on all these different medications, but also home dialysis options, and also managing your eating on our website, kidneyfund.org. One piece, Kathy, because I know you serve in our dietitian advisory group, I wonder if you could talk a little bit about our Kidney Kitchen website, and which is kitchen.kidneyfund.org, and I'll ask my team to drop that link in the chat. But I know you help us think through that and inform that website, so I'd love your thoughts on that site.
Yes, I think that website is very helpful, especially for someone who wants to find a trove of recipes. They have it categorized out, and you can search it by even things like, what are food? If you're trying to be mindful of the potassium, you can search it under low potassium recipes or low phosphorus. And not only that, but there's also things like for diabetes or vegetarian, vegan, things like that. I think it helps. It's so far one of the only free available ones online right now that I'm aware of, that I let patients know about, because you can then build like a menu for your week based on what you want to eat or what you normally have at home in your fridge. It's very common for people to ask when they come to dialysis or just in the public, can you make me a diet plan or a menu? I personally don't think that it works that way, because someone can tell you what to eat, but if you don't normally eat that, it's going to be very difficult to follow. So for someone to have access to a resource like the Kidney Kitchen, you can build a menu based off of what you normally eat or what you normally have in your pantry.
Great. Well, I think one of the most important things I think that we're hearing here is really being an advocate for your health and talking to your healthcare team. I'm going to maybe ask each of you a little bit of a different question related in that vein. And Asia, I'm going to come to you first. I certainly have met people. I went to my 25th high school reunion several years back, and I was telling people the work I do and our Galpal campaign, and I had several different people come to me and like corner me and say, I haven't been able to talk to anyone about this gout. It's embarrassing. I mean, grown men crying about what they're dealing with and the tears from the pain from gout. What are your recommendations in kind of, bridging that gap and talking to your provider and your healthcare team about managing gout?
Absolutely. So gout has a terrible stigma attached to it. It's a disease of rich people, of gluttony. You're just eating a bunch of terrible foods, it's getting in your body. You can't move around. And so it's embarrassing. Nobody wants to be known as the person who has a swollen big toe. But as we know as professionals, it's a lot more than that. It can affect your entire aspect of life. It's a big reason why a lot of people aren't going to work. It's a big reason why people aren't interacting with their families. When you're having a gout flare, you actually have a tough time just carrying on with your day. So something that impacts your life that much, we have to get together and kind of say that it's okay. It's not, a lot of times gout is genetic. So what we tell people to do, connect with your care team. The very first time that you have a flare, you don't exactly know what's happening. You just know you're having like the craziest pain in one part of your body. When you finally get to a provider, be it through urgent care, be it through your PCP, ask questions. Ask, hey, how do you think this happened? Hey, what can I do to help myself? And then really feel empowered. But that is why we also say, like when you're at your school reunion, continue to have those spaces of communication. Find other patients, confide in your family, your partners, so that you can have not just a medical care team around you, but support around you so that when you are having a flare or you are suffering, you don't feel alone and you feel a little less uncomfortable and embarrassed with what's going on. Once you kind of get a rheumatologist, they'll connect you with either a dietitian. They'll see if you kind of need additional renal care. And from there, build out your experience. Gout is chronic. A lot of times people have a flare. They have one, they get some kind of treatment for it, and they think, okay, this will never happen again. It likely will. So we have to really get a little more comfortable with saying, hey, I do have this disorder. It is connected to my kidneys. What can I do to better myself and to just get to a healthier place?
Yeah. I mean, it's a little moment of uncomfortability to really get into a better place from equality of life. And Dr. Budd, I mean, I think that certainly happens in dialysis. You know, there's unfortunately so many patients that end up, crashing into dialysis through the emergency department, and they have to start in center. What recommendations do you have for them for having that conversation with their provider to look at home options?
Well, to your point, Asia brought up a great point. I think patient support groups can be very beneficial to a lot of people in different disease states, right? Because no one knows what they're going through other than the people that are in there. Like I can't relate to it because I'm not in that state. I actually coincidentally have a patient of mine where I'm trying to get a fistula in her. She's late stage CKD 4, coming close to 5. And I'm trying to get a fistula in her because she's like GFR is like 17, and she just doesn't want an access. But she's started to talk to a patient education support group. And she said because you're talking to that, she's coming closer to actually letting me put that dialysis access in her. So you can see how the benefit would be from doing something like that. And as far as education of like dialysis patients on home, so I'm a big believer that the nephrologist has to be a salesman for home dialysis. So I don't think we should just be like telling them, you can do home, you can do in-center, you can do PD. You have to be like, you can do PD, you can do home HD, and this is how we're going to do it, and this is the support system we're going to give you when you're doing home. So I think in many respects that education has to be kind of motivational in many respects, and the doctor has to really buy into it. Not only just the doctor, but the medical assistants, the nurses, the educators. Like you have to be on team home dialysis in order for it to really be implemented. Because people are scared, but they need to know that there's support for you, not even just patient support, but a lot of support from the case manager, dietitian, and all that stuff that they have readily available.
Thank you so much. I mean, that's such a key point. And, it doesn't have to be the doctor if you're in center coming around on their rounds. It can be any of those people that you just mentioned, including, the dietitian they may be talking to. Kathy, kind of a similar question to you. We even here at AKF try not to say the word diet, managing diet, because it has such a awful stigma attached to it as well. We try to say healthy eating and, food choices. So what recommendations do you have for someone that's maybe afraid to have an honest conversation with you about what their diet looks like and how to get things in the right way and start the conversation with you to get their life in a better place?
Well, first of all, I think as a care team provider, I always the first thing I say, let patients know, is I am not the food police. I'm simply here as an open book, as a source, as a resource for them. I'm not going to judge them. And I hope that for those listening, if you're a patient, if you have CKD, that you can see your providers that way, that they are not there to judge you. They're not there to tell you what to do, although sometimes it might feel or sound that way. But ultimately, they have the best interests in mind for you. They want you to be healthy and to live many more years. And that's why they probably are making the recommendations as they are. But to have that in mind, hopefully that can help you be more open to letting your doctors, your dietitians, your nurses know what's going on. And especially, and I really want to emphasize this, especially when you don't agree with something or something is very difficult for you to follow. Because it's only if you voice that's how the doctor or the nurse or the dietitian can know how to work around those situations. For example, in my line of work, talking and discussing and educating people about food, that's what I encourage people to do, is to let me know, okay, these are the foods that are high, these are the foods that are suggested to limit, but you tell me if that's realistic. If it's something that you really love and you can't do it without, then let me know. That way we can find other avenues to go about, so that ultimately we can still meet the end destination, which is to get whatever lab value it is to be low. I think another piece to tie into that, to tack on with like the benefits of home, is when you are honest with your providers about things like that, sometimes they can even find opportunities and possibilities that can bring you more freedom. Like a lot of patients that I see here at the dialysis center, they can never fathom being able to feel well again, mainly because they're so used to feeling how they currently are. Not that they're not well, but from what I've heard with my teammates that work in the home dialysis center, they can actually feel a whole lot better. And the thing is, whether someone chooses in-center dialysis or home dialysis, it's not always set in stone. Like, what I mean by that is you're not stuck with that decision for the rest of your life. You're at home dialysis now, but you can check out, in-center dialysis, you can check out home dialysis and see what it's like. Go through the training if you feel like that's something that you want to try. And then if things work out, that's great, because you get those hours back. You get the freedom of doing dialysis according to your schedule. But if for some reason it doesn't work out, you can always come back to in-center.
Great.
Can I comment to that, Mike? So
Yeah,
Kathy brought some excellent points there. One of which is that conversation that those patients want to have. And on the in-center experience, when you're in a chair next to like 10 other people, it's hard to have an open conversation with your doctor or dietitian, social worker about financial issues. What's great about the home dialysis scenario, whether it be ED or in-center, you have more of a, like, you meet those patients, meet your doctor and your team in a room by yourself. So you feel more open to express those needs. And that's what I've seen with a lot of patients. And another benefit to the home dialysis scenario, I think, that goes under recognized, is that more intimate relationship with your care team that you can have, as opposed to being out in the open in a dialysis chair with so many people.
Great. Well, we only have about 6 or 7 minutes left here, and we actually got a question, Dr. Butt, to step back just a little bit, and if you can do this in just a few minutes, just a brief overview of the two kinds of home dialysis that are available to patients.
Yeah. So basically, there's two types of home dialysis. So you have the in-center experience, right, which involves needles and blood. So you can do that needle and blood dialysis at home as well too. So typically, home in-center dialysis is Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Each session is 4 hours. The home dialysis, hemodialysis experience is typically more days in the week. So it could be 4 to 5 times a week. It could be 2 to 3 hours each time, but you're getting clean more often and more frequently. So it's not as long as the 4-hour session, but it's more there. And you typically have to cannulate yourself. You have to stick yourself or have someone there that can cannulate the fistula there. So that can be a hurdle for some people. But one of the biggest ones I'm an advocate for is the peritoneal dialysis one. And the peritoneal dialysis one involves no needles, no blood at all. There's a tube in your abdomen. You have a little machine by your bedside, the size of an old school VCR. It doesn't look like a VCR. They're actually very modern now. The machines even talk to you. Put some bags of fluid on those machines. Connect the bag to connect your little tube from your abdomen to it. Go to bed at night, and over the course of about 8 to 10 hours, that machine will push fluid into your abdomen, pull fluid out, push fluid in, pull fluid out. And so no needles, no blood, done daily at night when you sleep. So a lot more gentler on you. Kind of mimics a normal kidney scenario where you're getting cleaned every day, which is beautiful. Other thing about home dialysis, you have access to a nurse or someone on call 24/7. So if there's any time you have an issue, you can always call that person to get that advice you need.
Great. That was pretty impressive to get through those in just a couple minutes. So I appreciate you doing that.
I do that spiel all the time. So it's like
well, one thing I would recommend as well, and I'll ask my team to also put this in the chat as well, as part of our Kidney Health for All initiative that we have here, we've also developed a home dialysis decision aid, which is a really, really great tool for helping you think through your different options that are available to you and kind of thinking about, what your quality of life goals are as you're doing that. So I'll ask my team to drop that in as well. Kathy, I think a relatively easy question for you, but an important one nonetheless. Someone asked, how do I find a dietitian to help?
I would encourage you to first talk to either your primary care doctor or your nephrologist to see if they already have someone that they work with closely. Because oftentimes you might need a referral depending on your insurance and where you're at in the States. The other thing you can do is if you go on to the Academy of Nutrition and Dietetics, you can search for a renal dietitian. And those are dietitians who specialize in kidney disease and making recommendations and for people with kidney disease, either pre-dialysis or even during dialysis, patients on dialysis. That way, and I think you can even search it by if you just want virtual or within your area, and then you can their contacts will pop up, and then you can contact them, and then they will work with you in terms of insurance coverages and things like that.
Great. Dr. Budd, a question from the chat regarding taking binders, because a lot of patients, especially on dialysis, are also worried about fluids. I mean, do you take liquids with the binders? That's the question that they're asking to swallow.
No, I haven't seen that. I usually recommend, and Kathy can comment to this, I usually let them take the first bite of the food, then maybe add the binders in there. At that, you don't have to necessarily. But the thing is, sometimes those pills are big and they're difficult to swallow, so you may need some fluid. Of course, if you're on dialysis, you need to restrict your amount of fluid, so that could be a kind of a catch there. But overall, you don't necessarily need to. I usually tell them just to add it with the food that they're taking.
Great.
I think,
yeah.
Like the doctor mentioned, if swallowing the pill, because the pills, certain ones tend to be pretty big. If it is a hardship, again, that's another way to let your providers know. Even something as small as that, letting them know, because there are other binder options out there where you can, because some you can't crush, you have to swallow whole. Others you can crush and take either like as a powder form or crushed and then just swallow in little pieces. So just let your doctor know if you're having a hard time with the binders. Oh, another piece to add, I forgot to mention earlier, is within center, you oftentimes will hear people with, not everyone, some high phosphorus, high potassium. And that's because on dialysis, like the doctor mentioned, you have a set prescribed amount of time, and then people have to go for the next set of people. So there's only so much of potassium and phosphorus you can pull out. It's not a whole lot. And that's why it's so important to talk about the foods when it's high. Home dialysis, the sessions are a lot longer, and that's why they are able to pull out a lot of those more effectively.
Great. Well, we only have about a minute or so left. I'm going to come around just really quickly, and each person, just like one thing that you want people to take away, as if there's one thing to do or to think about when leaving the session. Asia, why don't I go to you first?
I think my sticking point would be whether you have gout and CKD, you're not alone. There are other people there that are suffering or also just living through it. So build your community. Know that there's resources with the Kidney Fund, with the Arthritis Foundation, and you always have help. You're never by yourself.
Great. Dr. Budd, I'll come to you next.
I'd say if you're a patient out there, be an empowered patient, right? And the way you be an empowered patient is you ask questions and write them down before you go see a clinician. But 2 is get involved in your own healthcare. One of the best ways to get involved in your healthcare if you're a dialysis patient is to do dialysis. It may seem like more work on you, but when you're in charge of your own healthcare, you will have a better outcome. So,
thank you. Kathy?
Sticking point would be your providers are your cheerleaders. We're alongside you on the road. And so be honest as you go through this journey with us, because like Asia mentioned, you are not alone on this. We're here to help.
Great. Well, unfortunately, we're out of time. I want to thank all of our speakers and all of you in the audience for your great questions today. Please follow us on social media. You can visit kidneyfund.org to find out about resources like this. And thank you so much for our panelists for this engaging and informative dialogue. We hope you found this discussion helpful. Our next session is home dialysis safety, infection prevention and management, and that will begin at 11 a.m. Eastern. Thanks again.